Thank you once again for your continued support. We would like to begin by sincerely apologizing for the errors in some of the answers provided in our previous listening exercise. However, we have carefully reviewed and corrected any such mistakes in this video. We encourage you to share the number of correct answers you achieved in this test in the comments below. Please don't forget to share and subscribe to our channel for more resources and support in your OET preparation.
Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1.
You hear a patient called John Smith with chest pain talking to his doctor.
Good morning, Mr. Smith. I understand you've been experiencing some chest pain?
Yes, doctor. It started suddenly last night, and it was really alarming. The pain was sharp, almost like a knife stabbing right into my chest. It wasn't just the pain that scared me, it felt like it was radiating out, down my left arm, and even up to my jaw. I remember hearing that chest pain spreading like that could be a sign of something serious like a heart attack, so I panicked. I took some aspirin right away, hoping it would ease the pain, but it didn't seem to have much effect.
That must have been very frightening for you. Aside from the chest pain, did you notice any other symptoms that might be related?
Yes, actually I did. I started feeling really nauseous shortly after the pain began, and I was sweating a lot, almost like I was drenched in sweat. It wasn't just a little bit of discomfort, I felt like something was really wrong. The pain persisted through the night and didn't get any better by morning. In fact, it intensified, which is when I decided to call an ambulance. I've never experienced anything like this before, and while I don't have any known respiratory issues, my father did have a heart attack when he was relatively young. That history has always been in the back of my mind, so naturally, I was extremely worried.
I can understand why you were so concerned, especially with your family history. It's important that we take this seriously and investigate further. Besides this recent episode, have you been dealing with any other health issues or changes in your health recently?
Well, it's been a pretty stressful time at work lately, which hasn't helped my overall well-being. About 2 weeks ago, I finished a course of antibiotics for a chest infection. The infection cleared up, but I was left feeling a bit run down. I'm not on any regular medications, except for the occasional antacid when I get indigestion, which happens from time to time. I do smoke, though, about 10 cigarettes a day. I know that's not good, and I've been meaning to cut back. My last checkup was about 6 months ago, and everything seemed normal. Then blood pressure, cholesterol, all of that was within the usual range.
Thank you for providing such detailed information, Mr. Smith. Given your symptoms and the factors you've mentioned, like the family history of heart disease, recent stress, and smoking, it's essential that we conduct a thorough examination and possibly some tests to rule out any serious conditions, such as a heart issue. We'll start with an ECG to assess your heart's activity and go from there. In the meantime, I want you to try and stay as calm as possible. We're going to take good care of you.
You hear the mother of a patient called Emily Johnson having a pediatric consultation for rash on Emily's arms and legs. Good morning, Mrs. Johnson. I understand you're here today because you're concerned about Emily. Can you walk me through what's been happening?
Yes, doctor. It all started about 2 days ago. I was helping Emily get ready for bed when I noticed a rash developing on her arms and legs. At first, I didn't think it was anything serious. I thought maybe it was just a mild skin reaction, perhaps to some new soap or detergent we had recently started using. I didn't want to overreact, so I decided to just keep an eye on it.
That makes sense. Sometimes rashes can be caused by something as simple as a change in skincare products. But it sounds like things didn't stop there.
Exactly. Later that night, Emily woke up feeling really warm, so I took her temperature, and it was quite high, around 39 degrees Celsius. Naturally, I was worried, so I gave her some paracetamol to try and bring the fever down. It seemed to help a little, but not as much as I had hoped. The fever stayed pretty high, and she was very uncomfortable.
I can understand your concern. Fever combined with a rash can sometimes be a sign of an underlying infection. Did you notice any other symptoms around this time?
Yes, actually. By the next morning, the rash had spread. It wasn't just on her arms and legs anymore, but also on her back. Then, she started complaining that her throat was sore. That's when I really started to worry. I called our GP immediately. He told me to keep an eye on her and to make sure she was drinking plenty of fluids to stay hydrated. He said that if her symptoms didn't improve or if they got worse, I should bring her in right away.
It sounds like you did all the right things. Staying hydrated is crucial, especially when dealing with a fever. How has she been since then?
Unfortunately, she hasn't been getting better. Yesterday, she seemed more tired than usual, really lethargic, actually. And the fever hasn't gone down much, despite the paracetamol. She's not her usual energetic self at all. And it's really starting to worry me.
I can see why you're concerned, especially with the combination of these symptoms. Has Emily been in contact with anyone who has been sick recently?
Yes, there's been an outbreak of chickenpox at her school recently. Several of her classmates have come down with it, and the administration has sent out notices to inform all the parents about the situation. We've been monitoring her closely for any signs or symptoms, but so far, she seems to be doing well. She's up to date with all her vaccinations except for the flu shot, which we were planning to get for her later this month. We've always prioritized keeping her immunizations current to ensure she's protected against common illnesses, especially those that can spread easily in school environments. Typically, she's a very active and energetic child who loves participating in sports and outdoor activities. She rarely falls ill, and even when she does, she recovers quickly without any complications. Her strong immune system has always been something we've been thankful for. As for our family's medical history, there are no known allergies or chronic health conditions on either side. We maintain a healthy lifestyle by eating balanced meals, staying active, and going for regular checkups. Overall, we consider ourselves to be in good health, which we hope contributes positively to her well-being as well.
That's helpful information. It's good to know that she's generally healthy and up to date with her vaccinations. Even so, chickenpox is a possibility we'll need to consider, especially given the outbreak at her school. We'll need to run some tests to determine what's going on and make sure we address her symptoms properly. I'm glad you brought her in today so we can get to the bottom of this.
That is the end of Part A. Now look at Part B.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
Mrs. Thompson, who is currently in room 312, has just been brought back from the operating room following her hip replacement surgery. As you might expect, she's still under the effects of anesthesia, which means she's quite groggy and will need close observation during these critical first few hours post-op. It's essential that we monitor her vital signs frequently, her blood pressure, heart rate, respiratory rate, and oxygen saturation, since any changes could indicate potential complications like bleeding or a drop in blood pressure due to the anesthesia wearing off. Pain management will also be a key focus during this time. We need to keep a close watch on her pain levels, as post-operative pain can sometimes escalate quickly. Make sure to administer the prescribed analgesics according to the pain scale ratings, and don't hesitate to reach out if she's still in discomfort despite medication, as we may need to adjust her pain management plan. Positioning is another critical aspect of her care right now. Because she's immobile and at risk for developing pressure sores, we need to ensure she's properly positioned to relieve pressure on vulnerable areas. Use pillows or foam pads to support her, especially around the hips and heels, and make sure to turn her at regular intervals to promote circulation and prevent skin breakdown. Her fluid balance is equally important, especially since she hasn't been able to drink anything during surgery. We need to initiate IV fluids to maintain her hydration and electrolyte levels. Once she starts to regain full consciousness, encourage her to begin with small sips of water to rehydrate her system gradually. It's important not to rush this process, as she may still feel nauseous or have difficulty swallowing until the effects of the anesthesia fully wear off. Overall, our goal is to ensure she has a smooth recovery in these immediate postoperative hours, so let's work together to keep her comfortable, stable, and on the path to healing.
Mrs. Thompson, I understand that you've been having some discomfort in your stomach since you started taking your new diabetes medication. I want you to know that this is not uncommon. Many patients experience gastrointestinal side effects when they begin a new medication, particularly for managing conditions like diabetes. It's important that we address this because I know how uncomfortable it can be, and we want to make sure that your treatment is as smooth and effective as possible. One of the first things we can do to help reduce this discomfort is to adjust how you're taking the medication. Instead of taking it on an empty stomach, try to always take it with food. This can help buffer the medication in your stomach and reduce irritation. A small meal or even a light snack can make a big difference in how your stomach handles the medication. In the meantime, I'll also consult with Dr. Lee, your primary care physician, to see if we might need to explore other options. There are different medications available that manage blood sugar levels effectively, and sometimes a simple change in medication can alleviate these side effects. Dr. Lee might suggest an alternative that's gentler on your stomach, or perhaps an adjusted dosage that could help minimize the discomfort. However, for now, please make sure to take your medication with meals, as this is often a simple yet effective way to lessen stomach upset. We'll monitor how you're feeling over the next few days, and I'll keep you updated on any recommendations from Dr. Lee. Your comfort is our priority, and we're here to ensure that your treatment plan works well for you with as few side effects as possible.
Mr. Carter, it's wonderful to see your dedication to improving your cholesterol levels through dietary changes. This commitment is a significant step towards better heart health. We'll be working together to incorporate more heart-healthy foods into your meals, such as oats, which are rich in soluble fiber, nuts, which provide healthy fats and antioxidants, and fish, particularly fatty fish like salmon, which is high in omega-3 fatty acids. But these foods can play a vital role in lowering your LDL cholesterol and improving your overall cardiovascular health. At the same time, it's crucial to be mindful of avoiding foods high in saturated fats, which can contribute to higher cholesterol levels. This includes steering clear of fried foods, which are often loaded with unhealthy oils, and full-fat dairy products, which can contain significant amounts of saturated fat. Another important aspect of managing your diet is to get into the habit of reading food labels carefully. Many processed foods can contain hidden sources of unhealthy fats, like trans fats or hydrogenated oils, even if they appear healthy at first glance. If you ever come across a food item that you're unsure about, whether it's something you're considering adding to your diet or something you're currently consuming, please don't hesitate to bring it to our next session. We can go over the ingredients together and decide whether it fits into your heart-healthy eating plan. Remember, I'm here to support you every step of the way as you work towards your health goals.
Losing weight is certainly a challenge, and I completely understand how daunting it can feel at times. However, with the right approach and support, it's absolutely something you can achieve. It's important to remember that weight loss is not just about cutting calories, it's about making sustainable lifestyle changes that will benefit your overall health in the long run. I suggest starting with a balanced diet as your foundation. This means incorporating a variety of fruits and vegetables into your daily meals, as they are rich in essential nutrients and low in calories. Fruits and vegetables not only provide vital vitamins and minerals, but also add fiber to your diet, which helps with digestion and keeps you feeling full longer. You might also want to consider swapping out processed foods and sugary snacks for healthier alternatives like whole grains, lean proteins, and healthy fats, which can help regulate your energy levels throughout the day. To ensure you're on the right track, I'm going to refer you to our diet and nutrition counseling service. They specialize in creating personalized meal plans that align with your specific needs and goals. In these sessions, you'll receive tailored advice on portion control, food choices, and how to make gradual, yet impactful, changes to your eating habits. The counselors will also provide ongoing support, helping you stay motivated and addressing any challenges you might face along the way. With this combination of a balanced diet and professional guidance, you'll have the tools and support you need to make meaningful progress towards your weight loss goals. Remember, you don't have to do this alone. We're here to help you every step of the way.
Your blood test results have come in, and they show that your iron levels are significantly lower than normal. This low iron level is likely the reason you've been experiencing that persistent fatigue and lack of energy lately. Iron is crucial for producing hemoglobin, which helps transport oxygen throughout your body, so when your iron levels are low, it can leave you feeling very tired. To address this, I'd recommend that you start taking an iron supplement. This will help to quickly replenish your iron stores and improve your energy levels. In addition to the supplement, it's also important to focus on incorporating more iron-rich foods into your daily diet. Foods like leafy green vegetables, such as spinach and kale, and red meats, such as beef and lamb, are excellent sources of iron. These dietary changes, combined with the supplement, should help boost your iron levels and alleviate some of the fatigue you've been feeling. It's also important to pair these iron-rich foods with foods high in vitamin C, like citrus fruits or bell peppers, as vitamin C can enhance iron absorption in your body. If you have any questions about how to integrate these changes into your diet, or if you notice any side effects from the supplement, please don't hesitate to reach out. We'll monitor your progress and adjust the plan as needed to ensure you're on the right track to feeling better.
Recent blood pressure reading shows that it's slightly elevated, which is something we should keep an eye on to ensure it doesn't develop into a more serious issue. Elevated blood pressure can increase the risk of heart disease and other health complications if left unchecked. To get a clearer picture of how your blood pressure is behaving over time, I'd like you to monitor it regularly at home over the next week. I'll provide you with a blood pressure diary where you can record your readings each time you check your blood pressure. It's important to take these readings at the same times each day, ideally in the morning and evening, and try to do it when you're relaxed and sitting quietly, as stress or physical activity can temporarily raise your blood pressure. Make sure to note down any relevant details, such as how you were feeling at the time or if you had just eaten, as these factors can also influence the results. Once you've completed a full week of monitoring, bring the diary with you to your next appointment. We'll review your recorded readings together to see if there's a consistent pattern or if there are any spikes that we need to address. Depending on what we find, we may discuss lifestyle adjustments such as dietary changes or stress management techniques, or if necessary, consider medication to help manage your blood pressure. This proactive approach will help us ensure that your blood pressure stays within a healthy range, reducing your risk of future complications.
That is the end of Part B. Now look at Part C.
Good afternoon, everyone. Thank you for joining me today. My name is Dr. Sarah Collins, and I am a neurologist with a particular focus on stroke recovery and prevention. Over the years, I've had the privilege of working with numerous patients who have faced the challenges of recovering from a stroke, and one of the most pressing concerns we all share is how to prevent it from happening again. Today, I want to delve into a topic that I believe is absolutely vital for anyone who has experienced a stroke: the steps we can take to reduce the risk of a second stroke. While taking your prescribed medications as directed is undoubtedly crucial, there's another element of prevention that often doesn't receive as much attention as it should: regular physical activity and exercise. Physical activity is not just about maintaining fitness or losing weight, though those are certainly important benefits. It plays a fundamental role in improving cardiovascular health, which is central to stroke prevention. Engaging in regular exercise helps strengthen the heart, improve circulation, and manage cholesterol levels. These factors collectively contribute to a healthier vascular system, which is less prone to the kinds of blockages and clots that can lead to a stroke. Moreover, exercise is a powerful tool in managing weight and controlling blood pressure, two key risk factors for stroke. Being overweight or obese puts additional strain on your heart and blood vessels, increasing the likelihood of another stroke. Similarly, high blood pressure is one of the most significant risk factors for stroke, and regular physical activity can be an effective way to keep it in check. But the benefits of exercise go beyond just the physical. Regular physical activity has also been shown to improve mood, reduce stress, and enhance cognitive function, all of which are crucial for overall well-being and recovery after a stroke. I'd like to share with you the story of one of my patients, Mrs. Thompson, whose journey through stroke recovery has been both challenging and inspiring. Mrs. Thompson experienced her first stroke at the age of 60. Like many people, when she first noticed the symptoms: sudden weakness on one side of her body and slurred speech, she didn't immediately recognize them as signs of a stroke. She thought perhaps it was just a temporary issue, something that would pass with time. This assumption, however, led to a delay in seeking medical attention, which, as we know, is often a critical mistake in stroke cases. The faster a stroke is treated, the better the chances of minimizing damage to the brain and improving the outcome. By the time Mrs. Thompson arrived at the hospital, the stroke had already caused significant damage. Her initial period of rehabilitation was particularly challenging. She was introduced to a rigorous program of physical therapy and cognitive exercises designed to help her regain strength and function. Understandably, she found the exercises demanding, both physically and mentally. There were days when she doubted whether the hard work was worth it, questioning if the exercises were truly necessary. She wondered if she would ever return to her previous level of independence and quality of life. However, Mrs. Thompson's turning point came when she joined a support group for stroke survivors. Meeting others who had faced similar challenges and hearing their stories of perseverance and recovery gave her a new perspective. She realized that she was not alone in her struggles and that the rehabilitation process, though difficult, was crucial for her long-term recovery. The support group provided her with the optimism and motivation she needed to continue pushing through the tough days. She began to understand that every small improvement in her strength, balance, and cognitive function was a victory, bringing her closer to regaining control over her life. One of the most common issues I observe among my stroke patients is a failure to recognize the early warning signs of a stroke. Just as in Mrs. Thompson's case, this can lead to dangerous delays in treatment, resulting in more severe outcomes. This is why raising awareness and educating patients about stroke symptoms is so critical. The signs of a stroke, such as sudden numbness or weakness, confusion, difficulty speaking, or seeing, should never be ignored, even if they seem to come and go. Quick action can make a life-saving difference. This brings me to the broader point about the importance of patient education. Educating patients goes beyond just informing them about their medication regimens. It's about empowering them to make informed decisions about their lifestyle, to recognize when something isn't right, and to seek help immediately. By understanding the risk factors for stroke, such as high blood pressure, diabetes, and smoking, patients can take proactive steps to reduce their risk. They can also become more engaged in their rehabilitation process, knowing that their efforts are key to their recovery and to preventing another stroke. Ensuring that patients like Mrs. Thompson are well-informed and proactive about their health is not just beneficial, it's essential. It's essential for successful recovery and for the prevention of future strokes. Through continued education, support, and encouragement, we can help our patients lead healthier, more fulfilling lives.
Good morning, everyone. I'm Dr. Michael Adams, a pulmonologist specializing in the treatment and management of chronic obstructive pulmonary disease, or COPD. As many of you know, COPD is a complex and chronic condition that requires a multifaceted approach to care. Today, I want to delve into some of the critical elements involved in managing this condition effectively. One aspect that I cannot emphasize enough is the consistent use of prescribed inhalers. These devices are not just a convenience, they are absolutely essential in controlling symptoms, improving lung function, and preventing exacerbations, those flare-ups that can quickly spiral into serious health crises, often leading to hospitalization. To illustrate the importance of this, let me share the story of one of my patients, Mr. Harris. He was diagnosed with COPD in his late 50s, a diagnosis that came as a shock to him, as he had always considered himself relatively healthy. When I first prescribed an inhaler to help manage his symptoms, he was understandably hesitant. Mr. Harris felt that his symptoms, occasional shortness of breath, and a persistent cough were not severe enough to justify daily medication. He was also worried about potential side effects and the idea of becoming dependent on medication. However, it wasn't long before the realities of COPD began to impact his daily life. After a few weeks of struggling with worsening shortness of breath, fatigue, and more frequent coughing episodes, Mr. Harris started to recognize the necessity of incorporating the inhaler into his daily routine. He found that with regular use, his symptoms became more manageable, allowing him to breathe more easily and engage in activities he had previously enjoyed. In addition to the inhaler, I recommended that Mr. Harris participate in a pulmonary rehabilitation program. This comprehensive program included not only exercise training tailored to his condition, but also education on how to manage COPD effectively. Initially, Mr. Harris faced some challenges in attending the sessions, primarily due to transportation issues. However, once those were resolved, he began attending regularly and soon noticed a significant improvement in his breathing, stamina, and overall quality of life. This marked a turning point for him. The combination of proper medication use and regular exercise became a powerful duo in managing his COPD. Education played a key role in Mr. Harris's journey. After attending several educational sessions as part of the rehabilitation program, he became much more proactive in managing his condition. He learned how to recognize the early warning signs of a flare-up, such as increased shortness of breath or changes in sputum color, and took immediate steps to address them. This proactive approach is something I strongly encourage in all my patients. By catching flare-ups early, we can often prevent them from escalating into something more serious. One of the most common challenges I see among my COPD patients is their reluctance to engage in physical activity. This reluctance is often rooted in a fear of worsening their symptoms, particularly shortness of breath. However, this fear, while understandable, can be counterproductive. Regular physical activity is crucial for maintaining lung function, muscle strength, and overall health. It also plays a significant role in reducing the symptoms of COPD and improving quality of life. Another challenge is inconsistent follow-up with healthcare providers. Skipping appointments or failing to communicate changes in symptoms can lead to unmanaged symptoms, which can severely affect outcomes and lead to avoidable complications. Finally, I want to highlight the vital role of family support in managing COPD. Patients who have a strong support system are often more motivated to adhere to their treatment plans, including medication use, attending rehabilitation sessions, and making necessary lifestyle changes. This support can significantly improve their quality of life and reduce the frequency of hospital visits. Family members can help by reminding patients to take their medications, encouraging them to stay active, and providing emotional support, which can make a world of difference in managing a chronic condition like COPD. In conclusion, managing COPD effectively requires a combination of medication adherence, regular physical activity, proactive management of symptoms, and strong family support. With these elements in place, patients can lead healthier, more fulfilling lives despite their diagnosis.